Neuro-interventional surgery or neurointervention or interventional neuroradiology is one of the youngest branch of neurosciences. It involves the dealing with the vascular diseases of the brain and spine without opening the skull. It is usually done through a needle puncture in the groin, in the leg, and this procedure is performed in neuro-interventional cath lab. It involves an X-ray source to image where our miniature devices, that is catheters, balloons and stents are going. And the most common use of neurointervention, which has dramatically changed, is the management of brain hemorrhage caused by aneurysms, which is called subarachnoid hemorrhage, which we traditionally open the skull, bone flap, and clip under assistance of a microscope. The same procedure is done in a neurointerventional cath lab. By neurointervention means by putting in miniature catheters inside the aneurysm and packing it and blocking it from the main circulation. The same procedure is done from another disease which is called arteriovenous malformations. And as the science is progressing, the devices are becoming more versatile, more miniature, and from coils we have reached up to flow diverters, where a diseased artery can be reconstructed without opening the skull. It is really one of the very adventurous, very exciting, of course with a very steep learning curve, and it is benefiting a lot of patients. The most recent advances in last 5 years or so is the management of stroke. Acute ischemic stroke is a very debilitating disease which can strike anybody, anywhere. It has no prodromes, it has no warning signs, and suddenly the patient finds himself hemiplegic. If recognized in time, if it reaches a designated stroke center, or I say acute stroke center within 8 hours or 10 hours or whatever the time window is, then we treat the stroke as we treat a heart attack. As the public awareness is good about the heart attack, that a heart attack means that the heart artery is blocked and it has to be opened in a cath lab. In a similar way, in a stroke, the brain artery is closed, which has to be opened in a neurovascular cath lab, and the results are rewarding. The awareness is low even among the physicians, leave alone the population, but whatever the numbers we get, maybe 15, 20, 25 in a year, the results are really rewarding. The best thing about it is that there are minimal side effects. We do not cause more damage to the brain or the patient than what he is carrying, and more than 90% of the times we are able to open the artery. So neurointervention is a very exciting branch. It is a very young branch. It is progressing very rapidly, and the need for such specialists is increasing with every passing day. Thank you.